Good morning, everybody. This is Tammy from Tammy's Talk. So, as you know, my last video, I said that I would be having my surgery on July 20th, which is today. But that has been changed. I will have my double mastectomy on July 31st. The reason that was changed was because when I met with my plastic surgeon last week, they asked me if I was going to be doing my reconstructive surgery on the same day. And I explained to them that I didn't know that that was an option. I thought that you had to kind of heal before that, or I don't know. But he asked me if I wanted to do the surgery the same day, my plastic surgery. And the plastic surgery will be something called a D-flap, where they're going to remove the tissue from my stomach, and they're going to use that for my breast instead of me getting implants. So the surgeries together, I think they said the D-flap surgery will be probably like 5 to 6 hours. And I think it's called D-flap. I'm looking it up, like, you guys. But it's D-I-E-P flap. And it's a surgery, it says a D-flap surgery is a muscle-sparing breast reconstruction procedure using abdomen, skin, fat, and blood vessels to rebuild the breast after a mastectomy. So that's what we're gonna do. I am looking forward to that because I don't have to, one, I'm not gonna be totally flat. And then two, I'm not going to have like a foreign object in my body, like with the implants. You know, with implants, sometimes you have to, they may burst, or you have to go every so many years, I think, to have them like replaced or something like that. And I didn't want to go through all of that. So if there's anybody that has had the surgery and want to put some comments or some advice in the comments, please do. I've been reading up on, the healing, things like that. So I am going to be healing from 2 procedures. And, I'm not looking forward to that. But this journey has put me, this cancer journey has brought up some things, some unresolved things as well. Because when you're going through something like this, it can make you think about life differently. Some things that you took for granted. I took for granted being able to get up every day and just, I would get up in the morning, not a care in the world. Oh, I have to do my hair. What am I going to wear? What jewelry, or this and the other. Well, now it's like some of those things are like small things to me. And I find myself just going through the motions a lot, really. Some of you guys may have known me before this, know that my hair was really long. I had locks, and they were down to my butt, and I cut them off myself, and then I shaved my head because my hair started coming out. I ran my hand through my hair, and like a patch of it came out. So I decided, you know what, let's go ahead and just get rid of this. I have had some anxiety going through this, which is expected. Some depression, definitely, which is expected. I'm still processing a lot of this because I was diagnosed in February of this year, and everything has just been like a ball going downhill. It's just moving fast. You get the diagnosis, and then you meet your oncologist, and then you meet your surgeon, and then you meet, all these people, and then you start chemo or you start radiation, and, that was every 3 weeks. So people, we're moving, and sometimes you really don't have a chance to process everything because it's just like appointments and doctors and calls, and then you're looking for resources to help you make it through. People go through financial difficulties. I know I did. I was off work, and I, still catching up. I'm back at work right now, as you can see. So, please, if you have any questions or any comments, leave the questions in the comments. This is a new journey for me. I've been following some of the other cancer survivors, but one thing I wanted to do was talk about things and share things that can possibly help, because some of the things that I found are very helpful, and then some of the things that I found you have to pay for, and a lot of us are not financially in a position to pay for information that can help us through this journey. And when I mean pay for it, like, I've seen some sites, and they are, I'm not knocking anyone for doing what they do, so let me say that first. But some people are charging to learn certain exercises to do for mastectomies, or certain things to do for eating right, or getting your strength back up. There's a lot of things that comes along with healing, and if I can find some things to send your way, I will. Again, I said I was going to share a list of things that people are suggesting that you should get and have when you have your surgery. May it be a single mastectomy or double mastectomy. I can tell you a few things they were telling me about were button-down pajamas or button-down shirts, slide-on shoes, loose pants, nothing that you really have to tug to get on, because your motion, range of motion is going to not be the same for a while after you have your mastectomy. Cream to keep your skin moisturized, scar tape, if you can, elevated pillow. I think it's kind of like a ramp pillow or something like that, or a recliner, because you don't want to try to use your muscles and that core to get up out of a bed if you're laying flat. I've been told that that is not going to be an option for you. So yeah, just do your research, ask questions. I'm not a professional in this. I'm new to this. So if there's some things that I'm not saying right or not giving right, please put it in the information, because I just want to share this experience and this journey so it can help somebody else. So that's it. Thank you. Have a great day.